I'm Dr. Amita Shah. I'm a senior consultant obstetrician and gynecologist here at Columbia Asia Hospital. I have been into practice for the last 18 to 20 years. I have been a graduate of the elite King George's Medical College, Lucknow, and a postgraduate as well from there. Then I did my specialization in laparoscopic surgery and infertility training from Sir Gangaram Hospital. So primarily besides being an obstetrician and a gynecologist, I specialize in laparoscopic gynae surgery. That's my forte. Laparoscopic gynae surgery means where we are operating all gynecological complications, as in the presence of a fibroid in the uterus or an ovarian cyst or a cancer of the endometrium, cancer of the cervix. All this can be, or ovarian cyst, all these can be managed by laparoscopy, which is a minimally invasive surgery which I specialize in. For example, the removal of the uterus can be done by laparoscopy, which is a total laparoscopic hysterectomy. Now, this is a very minimally invasive surgery where we need to admit the patient just for 2 days. The post-operative pain is very less, the post-operative recovery is very fast, and the patient goes back home in just 2 days. The other commonest complication or the gynae problem happening these days is polycystic ovarian disease, or which is also known as ovarian cyst problem, which is commonly seen in young girls these days. Polycystic ovarian disease is where multiple small cyst formation happens in the ovary, consequent to which girls or young women generally have menstrual irregularities. They have infertility problem, there is difficulty in conceiving, and supposing if they do conceive also, then pregnant patients who have polycystic ovarian disease are more prone to abortions, they are more prone to preterm deliveries, then are more prone to cesarean section and all this. So polycystic ovarian disease can be treated medically as well as surgically. Medically, it is primarily a lifestyle disorder, so the mainstay of treatment is reducing weight, which is recommended to all patients, which means a regulated diet and regular physical activity. And obviously medicines are added. The medicines, if a patient doesn't want to conceive, then generally we put the patient on oral contraceptive pills to regulate her cycles, and if the patient wants to conceive, then we have to put the patient on ovulation induction drugs. So that's how it helps in the patient getting pregnant. Now, with pregnancy happening along with polycystic ovarian disease, the commonest drug that we give is metformin, which is also commonly known as glycomet. This we continue, initially we used to continue this for 3 months, but nowadays we continue it throughout pregnancy, and with the help of this drug, this medicine, the chances of abortions are reduced, the chances of preterm delivery are reduced. Here at Columbia Asia, we are doing a lot of infertility practice. We are treating a lot of infertility patients. We are doing everything here besides IVF, which is the last thing that is needed. But IVF is a procedure which is hardly needed by 20-30% of patients. Mostly it is the procedures prior to IVF by which patients can conceive, and we are doing all of them here. The commonest procedure to be done prior to IVF is intrauterine insemination, which is also known as IUI, which we are doing very successfully here. And we have our in-house lab where we are doing the semen preparation. And the results of IUI here are very good. Our results are about 50 to 60%, which is very good in any laboratory. Generally, the accepted success rate of IUI is 30 to 40%. So we are doing far better than any other labs.